Doctors are worried about the health of kidney patients on the island now that Guam Memorial Hospital's supply of the chemical reagent its lab needs to conduct tests for kidney health has shrunk so low that GMH right now is limiting its use. The secretary for GMH's medical staff, Dr. Vincent Akimoto, found out about the shortage last night when the hospital declined to conduct a kidney test he had requested for a patient.
We're unable to do a very basic test to tell us if somebody's in kidney failure or if any of the medicines we give them might be dangerous to give because their kidneys are not working. And that's always important. If you're in a car accident, a lot of the medicines or treatments that we need to do, it's the basic thing to be able to determine if your kidneys are okay.
And to make matters worse, he says doctors were never informed about the shortage.
We found this all out at 11 o'clock last night, at a time when we're unable to do anything to help our patients not be affected by this shortage that the hospital should have prevented and did not prevent. And it's really a matter of communication. You can't run out of stuff and then tell us about it the day after you've run out. And this didn't happen overnight. So it speaks to a lack of communication. And
in the past, Akimoto says shortages at GMH of even basic supplies like oxygen and penicillin were an all too common problem. But doctors had hoped the hospital now has the money it needed to address it. He adds that previous shortages have occurred when GMH officials chose to pay their staff instead of paying the hospital's debts to vendors. But in this case, hospital administrator Peter John Camacho says the shortage is instead due to a delay on the part of the supplies vendor, Siemens. And he says a resupply shipment of the reagents is due to arrive tomorrow.
There have been times, as in the past, Stefan, that because of non-payment to vendors, sometimes they will say we can't ship it until we get a certain payment. And so that has been more of something that has happened in the past.
Thanks to added funding from Gov Guam, he says the hospital does have a steady stream of money to keep its supplies in stock. The shortage comes at an auspicious time when GMH is applying for accreditation. But Camacho says accreditation officials will take into account the hospital's efforts to address such problems.
Any organization, any hospital, any healthcare institution is going to have problems, challenges that they face. What they're going to be looking for is how the organization is managing that.
Meanwhile, Camacho notes that the hospital was expecting its shipment of reagent chemicals last week, but he assures the public they will be here tomorrow. Stefan, Sebastian, PNC News.